Good afternoon, everyone. Thank you very much for joining us. We've spent the last 2 hours with the Surgeon General, Dr. Adams. We've had a great conversation. We start off with some of our senior team that's working on the pandemic, and then we had health leaders throughout the state from our hospitals, from our community groups, and as well as our local health department. So it was a great exchange of ideas. And Dr. Adams, thank you very, very much for being here. I'm going to turn it over to you, and then we're going to open up for questions.
Great. Well, thank you so much, Governor. Again, wonderful trip out here. And I just want to say the two words of the day are vaccines and vigilance. We need to really help people understand the hope that's now out there, because we have two vaccines that have received an emergency use authorization now. And we need to help people understand the importance of vigilance moving forward. We heard from providers across the state who were very concerned about hospital capacity because of COVID overfilling their beds. And so to people out there who don't feel at risk from COVID, who wonder what the benefit is of wearing a mask, I would just say to you, even if you don't feel that you are personally at risk or you're willing to take on that risk, understand that your loved one who's pregnant may not be able to get a hospital bed if they go into labor. You, if you get into a car wreck on an icy road, may not be able to get an ICU bed because all the beds are filled with COVID. So there are real tangible benefits to us wearing a mask. And I know this has become political, unfortunately, but I want to say to people, the science around mask wearing is now clear. Originally, we did not think that people could spread this disease if they did not have symptoms to the degree that they have been shown to. We now know that over 50% of the people spreading this virus are doing it without ever having symptoms. If the governor or I had a cold, you would know it. We'd have watery eyes, runny nose, we'd be coughing, we'd be sneezing. That's not the case with COVID. You could have it and have no idea that you have it. That is why scientifically we recommend now that everyone wear a mask when they're with people outside of their household, and know that it can help your health, it can help the health of those around you. It helps us get back to school, to church, to reopening, and it helps us preserve hospital capacity. And I just want to finish with a note on vaccines. Many of you saw me get my vaccination live on TV yesterday, along with the vice president. I did that because I want you to know, I've looked at the data. I've worked with the companies. I understand that this vaccine platform has been around for over a decade, so we know that it's safe. I know that the average vaccine trial has 5,000 to 6,000 people in it. These have had 30,000 to 60,000 people in their trials from a diverse group of individuals all across the nation. So we'll have more information on these vaccines at the point of administering them to the public than we've had for any vaccine in history. And that is why I wanted to walk the talk publicly, and everyone saw me get my first dose of vaccine. And by the way, because my mother-in-law and everyone else out there has been asking, she's right next door in Indiana, so she might be watching this right now. My arm feels fine. It's a little bit sore, but no more sore than when I had the flu shot. I didn't have any side effects at all, even though it would have been normal for people to have a little bit of a fever or headache or fatigue. That means that your body's actually doing what it's supposed to be doing and responding to the vaccine. So understand vaccines are safe. These vaccines are 95% effective compared to the bar we set, which was 50% effectiveness. Put another way, this vaccine is almost 100% certain to prevent you or your loved one from getting severe disease. It is the way we end this pandemic. And I want you to ask questions. I want you to know it's okay to have questions. It's okay to ask questions. What is not okay is to let misinformation or mistrust cause you to make a decision which is going to be bad for your health or your family's health or your community's health. So go to your State Department of Health website. They have a hotline you can call into. Get your questions asked about your vaccines. Talk to your health provider. If you haven't gotten your flu shot, it's a great time to get your flu shot now and ask questions about the COVID vaccine, because we want to put this pandemic away for good. The finish line is in sight. The last couple of miles of this race are going to be hard, but we've got to keep running, and that means wearing a mask, washing our hands, watching our distance, keeping these holiday gatherings as small as possible and within our household, and getting your flu shot now so that when it's your turn to get the vaccine, you can actually put this pandemic away for good and we can get back to normal. So with that, I'll turn it over to you for questions, Governor.
Dr. Adams, thank you very much, and we'll go to questions.
Okay, thank you. The first question is from Marty Schladen with the Ohio Capital Journal.
Good afternoon, Governor and Dr. Adams. Dr. Adams, I wanted to ask whether you've discussed with President Trump or Vice President Pence using the Defense Production Act or some other means to scale up production of the 2 vaccines that have already been approved.
Well, we've used the Defense Production Act literally hundreds of times. The last time we got an update at the task force meeting, they'd said they'd used it over 300 times alone for testing. We are leveraging every bit of authority, of power we have. But I'll tell you, these vaccine companies have every interest in the world to produce as many vaccines as they can because they want this pandemic to be over and because the federal government is purchasing these vaccines. So I can tell you with every degree of certainty from being on the coronavirus task force that we are doing everything we can to produce these vaccines as quickly as possible. And here's the good news. 20 million doses by the end of December is what we still expect, especially with the Moderna EUA yesterday. 50 million doses by the end of January total. 100 million doses by the end of February. That is half of the adult U.S. population. So we're on track to put this pandemic away. But what we need your help with as reporters is really helping people understand the process so that they have confidence and that they will get vaccinated. I'm more worried about that than I'm worried about supply of vaccine at the moment. I want to make sure we have good uptake. We've got to go from vaccines to vaccinations.
Okay, next question is from Adrienne Robbins at NBC4.
Good afternoon. My question is for Dr. Adams as well. We're a state that is seeing high rates of the coronavirus. We've been under a mask mandate for quite a while now, and as we know, it is going to be a couple of months until the general public is able to get the vaccine. What are you recommending to Governor DeWine to do and for the general population to do between now and then that we haven't been doing already to make sure that these numbers stay at a safe rate?
That is a great question, and we had a wonderful conversation about the governor's leadership in facilitating a zone response throughout the state where you've got the Cleveland area, you have the central area, and then you have the Cincinnati area hospitals all coming together to figure out how you deploy resources appropriately and move pieces around on the chessboard so that we can deal with the surge that is coming. From a prevention point of view, we actually anticipate that we can have every single senior and every single nursing home worker vaccinated by the end of 2020. So that's just a few weeks from now. If we can do that, then we can protect our most vulnerable and we can really start to turn that dimmer switch a little bit. It's not going to be a light switch, pandemic over. The dimmer switch that we turn up a few clicks, and we can start to have visits in nursing homes again, which is going to be great for the mental health of seniors. We can get our healthcare workers feeling safe so that you can get the care that you need and not worry about not having someone there to take care of you. And then to the people of Ohio, I want you to know, mask wearing does work. We know it works because estimates back in March and April were that 1 to 2 million people could have died by now. So every single death is a tragedy, and I would never downplay almost 300,000 people who've died in this country. But if it weren't for the people out there who are doing the right thing and wearing masks, we could have had many more, possibly well over 1 million people who've died in this country at this point. They do work. What's challenging is that more people are moving inside because of the cold weather. More people are having their bubbles expanded in households. And so we really need you this holiday season to make a smart choice. Keep your holiday gatherings small, keep them within your household, and know that if we do that this year, then we could start to get back to normal really, really quickly next year when you look at vaccinations along with increased at-home testing that's available and the other things that are very quickly coming into our toolkit.
Okay, the next question is from Danny Eldredge with Hannah News.
Hello, my question is for Governor DeWine. So the General Assembly is sending you a stand your ground bill. Can you talk about what you plan to do with that and what message that sends to the state in the wake of the Dayton shooting?
Well, I'm not going to discuss that today. We'll discuss that early next week. I'll have a lot more to say about it then. I made my position very clear that we should not be taking up bills like that when we have bills that have been in front of the legislature for a year, where we have really the opportunity to directly save lives. The one I've talked about, and you've heard me talk about, Danny, many times, is weapons under disability. Police officers are asking us, mayors are asking us to dramatically improve the law in this area. We could take violent repeat offenders off our streets, make it safer so that we don't pick up papers or hear on the news as often about a little 5-year-old who's been killed. So I said that before, but I'll fully address this early next week.
Next question is Karen Kessler from Ohio Public Radio.
Hi, good afternoon, Governor. You said yesterday you hadn't heard of any smaller shipments of vaccine that had been experienced by other states, that Ohio hadn't had that. But yesterday, the health department said the allocation for the second Pfizer shipment was lower than previously estimated by your federal partners. Are you having to readjust how the vaccine is going to be distributed in light of getting less than you were originally promised or told that you get?
Yeah, it does not appear that, the number that we're now being told, that's not going to slow us up in regard to the nursing homes. We are on track there. What the pharmacy companies have told us, the 4 that are vaccinating people in nursing homes, they have told us it will be 3 to 4 weeks. We're going to have a much better idea about the timing of that once they're in the field for a number of days. They've only been for 2 days now. So we'll have a better opportunity to adjust that and take a look at that. So we want as much as we can get, as fast as we can get it. But we're going to follow every week. They're going to tell us how much we're going to get. As soon as we get that allocation, that we know what it is, we will report that to you, report that to the public, so people can keep track.
And if I may, I would add that as the governor said, it is our desire, our commitment, our goal from the federal level to get as much vaccine out as quickly as we can. I want people to understand this is the biggest logistical undertaking from a public health perspective, likely in modern history. And so there are going to be challenges, but we're committed to transparency. And we still are on track, especially with the emergency use authorization of the Moderna vaccine that you all just heard about in the last 24 hours, which will increase the expected vaccine allocations next week over and above Pfizer, to be on track for 20 million doses from a federal perspective, still out by the end of this year. Those numbers, I want people to just understand. They're going to change a little bit back and forth because you have to deal with production companies, you have to deal with logistics of getting them from there to point B and point C. But we're going to work with the states and make sure we're getting as much vaccine out as quickly as we can, and immunizing for impact, really hitting the nursing homes and long-term care facilities as early as we can, and our healthcare workers, so that we can preserve capacity.
Jill, before we go to the next question, I don't know whether this has been announced yet, but General Harris about an hour informed me that yesterday HHS approved a waiver that will allow the Ohio National Guard personnel, from the medics to medical doctors, to administer vaccines to the general population. So that's a waiver that we had sought. We're very happy to get that. We cannot announce yet exactly how we will use the National Guard to do this, but I'm sure we will be using them. They have done a phenomenal job throughout this pandemic, everything from pop-up testing all over the state of Ohio, which continues to work in regard to logistics, in regard to food banks, to going into nursing homes and backing up staff when they have a shortage of staff. So the National Guard has been absolutely phenomenal. This gives us one more tool to use as we try to get vaccines out just as quickly as we can. We'll have more information about that when a determination is made about exactly what the Guard's role will be in regard to that.
Next question is from Pete Grieve with Spectrum News.
Yeah, so I wanted to follow up on the lowering of expectations for vaccine doses arriving, which went from 660,000 to now about 1 million or 530,000. Pfizer says that they don't have any delays. So can you pinpoint the problem? Is it the pharmacy partners in Ohio that aren't able to process 660,000, Governor? Or what brought those numbers down exactly?
No, look, this is not a question of processing here. This is a question of what they're telling us they're going to allocate. And again, I would just caution everyone. I think the best thing to do, we can tell you what the estimates are. The estimate now, as we look on the dashboard, is about 530,000 in December. But we should just watch every week and see what exactly comes in. And I think we'll let the news media know. And our goal is to get this out just as fast as we can. We're putting it, beginning next week with Moderna coming in. We hope Moderna comes in Monday, Tuesday. And of course, that is going to go out. 70% of that is going to go out to our hospitals. 30% of that is going to go out to our local health departments. And we've already outlined for you and for the public, what the health departments are going to do with that. So we'll keep you informed as the numbers come in. What we announced yesterday was what the number that we were seeing, the new number that we were seeing on the dashboard when we looked at it.
And again, those numbers will go up a bit, they'll go down a bit, because there are many different variables involved. And I hope that we are as excited and as effusive when we talk about the EUA that came across that's going to bump things up as we are when we talk about estimates that may go down. These are estimates, and we're doing the best we can at every level to give full transparency into what we expect at the moment. But everyone is working to get as many doses out as quickly as they can. And we still think that in the grand scheme of things, we will be on a timeline to have 20 million doses nationally, and that proportional amount that's going to come to Ohio delivered by the end of December, if not more so with this announcement of the Moderna vaccine. So I think that's the story there, is with the Moderna vaccine, it puts us in an even better place. And also this week, vaccinations of healthcare workers started, and they're going well. And we had a great update from the state about the cooperation between the state and Walgreens and CVS and the pharmacies to get our seniors vaccinated. That is a great story. It should give people hope, and it should help people understand that we actually do have a light at the end of this very long and dark tunnel.
And the pharmacy companies have told us, they don't know. They're going to have to see how long it takes to roll this out. This is new for them as well. But they've estimated that it'll take 3 to 4 weeks, beginning yesterday, to get the nursing homes, everyone in nursing homes who wants a shot, every employee who wants a shot. That's the goal, and we'll keep you informed. After we finish the first week, and they can kind of tell us, are they on track or not on track.
Next question is from Helen Maynard with WEWS.
Good afternoon, Governor. Good afternoon, Doctor.
Yeah.
We're looking at the vaccines, helping us see the light at the end of the tunnel here, but we're still dealing with high numbers of hospitalizations, and not so much as just hospitalizations, but increasing numbers of people showing up in the ICU. And so I don't know if this is a question for the governor or for the doctor. Maybe it's for both, but maybe for the doctor. What is the plan now going forward to support hospitals with this high number of patients in ICUs? You've got a 78% of hospitalization nationwide. You have 77 here in Ohio, so we're right about the national average. But in Northeast Ohio, you have several hospitals that just have 1 bed left in ICUs, just 2 beds left. And what's our plan to support them going forward?
Great.
Yeah, Dr. Adams, let me just give you the Ohio.
Governor.
Let me just give you the Ohio numbers, and then you can answer the question. The Ohio numbers are basically 1 out of 4 people in our hospitals are there because of COVID today, and 1 out of 3 on the average. 1 out of 3 people in ICU are there because of COVID. Those are what Ohio's numbers are now.
And when you ask about the plan, I think it is a great question. It's a fair question. And I tend to think of things in threes. So TSP, better treatment. And we talked a lot today with providers and with the folks in Ohio about how we can make monoclonal antibodies, convalescent plasma, remdesivir more available, because we know those things will keep people out of the hospital and or out of the ICU. And I was very excited to hear from folks from Ohio State talking about how they are really being innovative in providing these therapies in outpatient settings so that we can keep people out of the hospital. If you have recovered from COVID, please understand you can give plasma, and that can help keep people out of the hospital. You can go to thefightithinus.org to find out how to donate plasma. So that is treatment. Support. The governor has led a very robust support plan where within these zones that I mentioned, we're moving resources from places that are under capacity to places that are over capacity. The National Guard has been very innovative in terms of providing support and aggressive in terms of providing support. And from a federal perspective, we have sent DOD assets, public health service officers, and beyond to places that are hardest hit. So treatment, support, and then prevention. The best way to help our capacity is for everyone out there to understand the importance of wearing your mask, washing your hands, watching your distance, keeping your holiday gatherings small and smart. Better treatment, more support, and aggressive prevention, which is going to take everyone in Ohio doing their part. That's how we get through this surge.
The next question is from Daniel Trotta at Reuters.
Thank you very much. A couple of follow-up questions to both of you, if I may. First, for the Surgeon General, when you were talking about the Defense Production Act, are you saying that it's just simply not necessary because the pharmaceutical companies have enough incentive on their own? And also, this happens all the time when people talk about doses. When you were referring to doses, when you say 20 million, are you saying that 10 million people could receive the vaccine, considering the 2-dose regimen? Are you talking about 20 million people? And then for the governor, with regard to this potential shortage of doses, I just want to be clear. Are you talking about the same thing that General Perna mentioned today, saying that he, at Operation Warp Speed, had miscalculated the number of doses available to the states, and that there would be a downward revision this week? So my question for you, Governor, is how serious was that revision for this week, and what potential disruptions do you see in the short term?
Yeah, there's no disruption. I'll start off, Dr. Adams. There's no disruption. Our partners, pharmacy partners, have said 3 to 4 weeks. That is not going to be impacted. That's what they believe it will take to get through the nursing homes. Now, that's not all the congregate care settings, but it's certainly the most vulnerable. So that has not been impacted at all. What we're going to continue to see, because this is a national distribution, it's a production question, we're going to continue to see different numbers every week. And I think, we need to get used to that. And what we will simply do is, as soon as we know a number, that they tell us a number for next week, we will make that number available. But I think we have a general idea. We know we have a general idea of what we're going to get. And we're moving forward, and we're going to take whatever they give us when they give us. And this is, again, based upon population. It's a formula. We're going to get our fair share. And as soon as we know it's coming, we're going to let you know that. When it gets here, we're going to let you know that. And you can follow on our tracker that's going up either today or in the next several days. You can see how many vaccines have been given, how many individuals have received the vaccine, and you can break it down by race. You can break it down geographically. You can look into every county. Now it's slowly ramping up, and the pharmacy companies are not going to hit their full stride until probably Tuesday or Wednesday, but we're moving forward, and we're very pleased so far with where we are.
And I'll be very quick in my response because I know we've got other reporters who have questions. You asked about doses. It is 20 million initial doses, which will serve 20 million people by the end of this year. We actually have 40 million doses, but that's the first and the second dose combined that will be available by the end of this year. So 20 million people will be able to get their initial vaccinations, or at least there will be enough vaccines out there to get 20 million people their vaccinations before the end of this year. In Defense Production Act, again, I want to be clear. The pharmaceutical companies have every interest in the world in helping us get back to normal. And so that is one part of this. But we have been extremely aggressive in using the Defense Production Act in many cases to help them get the ingredients that they need to produce different products. Been used over 300 times. We are leveraging it where we need to use it. But you know, at some point, if they're working at max production and there's just no more supplies to input into the process, then saying that you're going to use the Defense Production Act is literally just saying you're going to use the Defense Production Act. We are aggressively using every tool we can, and I think we should be celebrating the fact that 10 months after we got the sequence of this vaccine, we now have 2 vaccines authorized. You know, it's not fast enough until it's too fast. And really what I want the media to think about is how you can help us promote vaccine confidence and uptake, because that will continue to be our concern. We talked about that with the governor and people across the state. What would be a real shame is if we actually had the tools to end this pandemic, but we either saw disparities worsen or the pandemic linger on, because the people who are hardest hit are often the ones who are most reluctant to take a vaccine.
Next question is Kaylee Remington with Cleveland.com. Okay, we will try to go back to Kaylee. Next question is Katie Anderson with WHIO.
Hi, good afternoon. You were just talking about vaccine confidence, but we've done a couple of stories, you know, just nationwide of people having allergic reactions to the vaccines. What would you say to people who may be fearful of that happening to them?
I'm so glad you asked that question so I could set the record straight. There are 2 reports of allergic reactions in the UK, 2 reports so far in the United States. We know that for vaccines in general, the rate of severe allergic reaction is about 1 in a million. We sent out between 2 and 3 million doses of vaccines this past week. So 2 allergic reactions puts the rate of allergic reactions to this vaccine at about the same rate that we would expect for any other vaccine we've seen out there. This is normal. This is expected. If you're someone who has had a severe allergic reaction to a vaccine in the past, please let your health provider know. But to everyone else out there, please know this means the system is working. We are recognizing and catching these very, very rare side effects. And in both of those cases, because these vaccines are administered in a healthcare setting, that they were able to be administered epinephrine right away, and both people fully recovered. So this is not abnormal or unexpected for any vaccine or any medication. Every single medication made can cause an allergic reaction in someone. It's really recognizing, is it a higher than expected risk? And in certain populations, and no, it is not in a higher than expected risk, and it is not in the general population that we're seeing these reactions, and we actually are promptly able to catch them and treat them. So you should be reassured. I got my vaccine yesterday, and I'm doing just fine so far, because I know that this will help us end this pandemic and protect lives.
Going back to Kaylee Remington at Cleveland.com.
Governor Kaylee doesn't want to talk to us.
I think she's having problems unmuting her phone. So
She's trying.
Let's go to Jordan Laird with the Dayton Daily News.
Afternoon. There have been some reports across the country of hospitals, at least in one case, giving their vaccines to personnel not directly caring for COVID patients rather than true frontline workers. How is the state and federal government making sure that hospitals and other institutions are allocating fairly?
Yeah,
Well,
I'll
let-
start.
Yes, please.
Yeah,
I was
go
gonna
ahead.
say, I'm gonna let the governor take that. Yes.
Well, I'll be quick and then I'll turn it over to you and you can, Doctor, you can give the national. We've made it very clear who's supposed to get it. We've sent out advisories to every hospital, to every one of our health departments. Pharmacies know it as well. So we've been very, very clear. We have trust in the hospitals, and we think that it's going to go well. Is it possible that in some cases someone will get it who doesn't fall within that category? Yes, I suppose it certainly is very possible. But we also have an obligation to get this out very effectively, efficiently, and quickly. And so a micromanagement at a high degree is not what is called for in trying to save lives. But we have confidence, though.
I couldn't have put it better than the governor did. He hit all the points that I was going to hit. You're going to have one-offs. This vaccine is in high demand, and we have to give some flexibility to people on the local level. Otherwise, we're going to micromanage it and slow the process down. But important to also understand that every hospital in every state is going to have to make tough decisions and sometimes some different decisions. A physician who's not caring for patients that are known to have COVID is not necessarily not caring for any patients with COVID, because we know in this surge, there are a number of people out there who are coming into your offices with COVID and they don't know it. 50% of the spread is asymptomatic. So as a physician who is still practicing myself, I personally don't see anything wrong with a hospital saying, we want to protect everyone in our hospital from the COVID that is in our community, and also give people the confidence that they can come in and get the care that they need for other things. A quarter of women said that they've skipped a prenatal care appointment because of COVID. 4 million children are behind on their vaccinations. My own wife was delayed in getting her cancer diagnosis this year because of COVID. So I don't think it's a problem if healthcare workers who aren't directly taking care of people who've tested positive for COVID get the vaccine. And as the governor said, if we micromanage too much, we're actually going to slow the system down and harm more people than we help.
Next question is from Tyler Paley at WTOL.
Good afternoon, Governor and Dr. Adams. Appreciate your time. Dr. Adams, you've spoken a lot about the vulnerable populations, obviously, and there have been calls from several groups, including the American Medical Association, which wants to see prisoners and inmates be among the priority group vaccinated after, obviously, healthcare workers and long-term care facility residents and staffers. I'm curious if you have an opinion on that as to where inmates should be ranked on the prioritization.
Well, from a state or from a federal perspective, we work with the National Academies of Science, Engineering, and Medicine, an independent group, so that no one feels the government is picking losers and winners. And we also get input from the Advisory Committee on Immunization Practices at the CDC. One thing I can tell you from the data and from what they've told us is that corrections facilities are high risk. Once the virus gets in, it spreads like wildfire in these facilities, and they should be considered a particularly vulnerable population. The governors in these states are going to have some tough decisions because everybody at this point thinks that they are a particularly vulnerable population or essential workforce. And as the vaccine rolls out, we're going to aggressively work to make sure governors have the flexibility to immunize for the greatest impact in their states. But I completely agree with you that we should all recognize our corrections facilities populations as being a vulnerable population and at high risk.
Okay, next question is from Laura Borchers at WEWS.
Yeah, good afternoon. We are now just days from Christmas. What changes do you have in your message about family gatherings for this holiday compared to Thanksgiving?
That is a great question, and I would tell people to go to cdc.gov holiday gatherings to see the updated guidance. We are telling people the safest way to spend the holiday this year is with the immediate members of your household, with the knowledge that once we get through this surge, we really will be on the downhill side of this pandemic. We want to get as many people as possible to Easter, to Memorial Day next year, to the 4th of July. And that's going to depend on our actions right now. But we also know that some people are just going to do what they're going to do in terms of gathering. And so if you are going to do it, go to cdc.gov and figure out how you can do it more safely. Some of the things we're recommending to people, it takes about 5 days for people to develop symptoms from the virus, if they're going to develop symptoms. We are about a week out from, a little less than a week out from Christmas. If you are going to visit someone outside of your household, now is the time to be especially prudent about limiting your bubble. Don't go out to a Ohio State football game party with 10 of your buddies and then go home to grandma, because you could take that virus home to grandma before she gets a chance to get vaccinated. And but for you making that small sacrifice now, your grandma might not be here for next Christmas. Very important. CDC also said that if you're going to travel, they recommend that you get tested before you travel if you have that option or ability in your community. And we just, from the FDA, authorized new at-home testing. In Ohio, the state of Ohio has several surge testing sites and several places you can get tested. Call their hotline to find out where you can get tested. But we recommend people get tested before they travel so that they know they're not taking the virus with them when they get on a plane, a train, a bus, or going to grandma's house. And then if you gather with people outside of your household, especially without a mask, then we recommend that you get tested 4 to 5 days after that gathering so that you can pick up that virus and we can slow the spread moving forward. These are just a few of the tips, but there are tips on how to more safely gather with other people, such as being outside, good ventilation, making sure there's plenty of hand sanitizer at cdc.gov /holiday gatherings, or you can just Google it.
Okay, Governor and Dr. Adams, that was actually the last question for the day.
All right. Well, Dr. Adams, thank you very much. We really appreciate you coming to Ohio, and it has been a good conversation, very helpful to us, and we're grateful for all of your good work.
Thank you, Governor. We're going to get through this, Ohio. Vaccines and vigilance, there is a light at the end of the tunnel. There is a finish line in sight, but you can't afford to stop running. We got to run hard to get to that finish line, and that means each and every one of you doing your part while we do our part at the federal level, and the governor and his staff do their part at the state level, because together we're going to get through this. And go Buckeyes.
Go Buckeyes.